Alpesh Patel. I'm a CEO and founder of Ravkoo Health. We are a healthcare technology company that provides a healthcare ecosystem. As Catherine mentioned earlier, we provide our B2B partners technology solution that can customizable and provide them a complete healthcare on technologies. So that's about me. I think we already heard Kathleen give her introduction.
We should mention Shayan. Dr. Vyas actually had damage to his home during Hurricane Ian, so he was not able to make it. And I feel bad about that because he's a rock star, awesome physician and been in telehealth a long time. He's the Chief Medical Quality and Innovations for Teladoc Health, which is actually a Microsoft partner. So I just want to shout out to him. So hopefully everything's okay with his house.
Yeah. So we can start.
So I'll start with the first question. So our title today is Insider's Perspective to Hybrid Care. So Alpesh, and I'm not on my phone. I'm actually reading the questions. I don't want people to think I'm a millennial and rude. Sorry, because I'm really not. Hybrid care today treats the disease. Can we apply technology and AI to expand and improve a person's overall health care?
Yeah. So hybrid care is all about technology. Pre-COVID, we never thought about hybrid care. This all things started after the COVID. You know, COVID, as we will hear this during this conference, COVID made things possible faster in healthcare, not just in the technology in healthcare, but everywhere else. Healthcare, it was fast moving. It took us 5 to 7 years ahead. So hybrid care, as you heard the speaker, starting with Catherine, she said perfectly fine. Like if you involve all the stakeholders in care, you can create an ecosystem and you can provide solutions, as Sudeep mentioned, that can combine everything in one platform. Hybrid care can be provided. It will help technology. And AI side, we already see that last week we looked at the AI in dermatology. Picture AI is also helping with capturing data for the diet food. So AI can help, and AI is all based on the data. So how good information and data you put into the system. So I would say after 5 to 6 years, this hybrid care model will go towards the more like virtual care. Just like pre-COVID, it was all retail-based, and 90% retail-based, 10% virtual. After 5 to 7 years, hybrid care model will go more 90% towards virtual and 10% towards retail.
Yeah, I agree. I think that we'll see people that where you can do virtual care, they will do virtual care versus in person. And I think that the technology, Dr. Schmidt talked about like the Kinect camera and the HoloLens, and then even your phone, like I think the iPhone 14 and the Pixels, the cameras have gotten so much better that if I had like a skin wound or something like that, I could show my doctor and they'd actually be able to look at it. And there's other devices that they're connecting to phones, right? Stethoscopes and things like that, which is pretty
So
cool.
I always like to compare health with wealth. Just think of like Chase Bank came up with that depositing your check first time, right?
Yeah.
So as technology will evolve, you see lots of digital health companies coming out, right? They're all coming out with a new technology or new innovation. So as technology will evolve, you have better data to put into AI. That will keep change the space and more towards virtual care, in my
Yeah, I agree. I think it's all about the data. Unfortunately, sometimes we have problems with the data, right? It's not accurate.
It's all about
whatnot.
how clean and how how good is your data.
Right. So I think data governance, right? If we get to like brass tacks, change management, part of that is around data governance.
Yeah, and I think the government will strict the rules and regulations around digital health also. This is just a starting point. So I think Catherine talked about the compliance that should be strictened as the digital health grows. There has to be a tight guidelines and governance towards the complete virtual healthcare.
Yeah, and Sandeep talked about the FDA, software as a service. I have customers that are already worried about that. They're building models. What's the compliance going to be? How are they going to be able to manage that and monitor that? And they're looking to, like my company, to help with those things because they don't think they have that ability to do it.
Yeah, because during the COVID, there are lots of digital health startups that don't have a good governance or compliance and data structures that started, and I think the compliance should come in effect next year or year after next
Yeah.
to control the companies how they actually provide care.
Yeah, that would marry, like the FDA for the devices. It took them about 18 months, so this just came out a couple weeks ago. So I think in 18 months, or a little bit shorter, maybe we'll start to see more clarity around that.
So Kathleen, I will have a question for you.
Sure.
Like, I think you already answered how hybrid care, what are the good examples of hybrid care? And how do you think, I was listening to your presentation, how do you see that will help the workforce?
So, well, for hybrid care, I think one thing we haven't touched on and we really should is that, for me, the reason why it's so important is that we need to have the cloud because there's just so much data. You have to really be able to leverage, some way to manage that data. So to me, it's all about the cloud, the computational power that we have, right? There's a lot of compute available now that we never had before, the algorithms that are built. How do we manage those algorithms? And then, of course, we've got all the privacy and safety issues, right? So I think that, or security issues, I think that, for me, that's why I think it's important. You need to have like that basis for hybrid. I think that and that's a really great question around the workforce. I don't know if I clearly answered that when I was speaking to it. I think that the new models of care are going to allow our workforce to work more efficiently and really be able to work top of license. And we see it today in many and sundry within organizations where even I have customers that I work with that are doing virtual care at the bedside. So you have a patient who's actually in the hospital. The nurses, are overwhelmed by the number of patients that are physically there. So they actually have brought in virtual nurses, like via tablet to a patient, to do things like discharge instructions, initial assessments, specific documentation to kind of offload from the nurse that's on the floor that needs to do the hands-on care. So I think that is, in my mind, that's kind of like a really classic hybrid, but the patient's actually in the hospital, right? So it's inpatient care being done by a virtual nurse. And the reason why I have hope for it is that organizations that I work with that are doing this are telling me, like, nurses are leaving in droves, they have a problem with attention, with attrition, just satisfaction, right, especially, and nurses are near and dear to my heart, so this obviously would cover any, clinician, right? And what they found is that, like, for 2 positions for the virtual nurse, they had 200 applicants, like, they couldn't, and it was, like, overwhelming to them. For their normal position on the bedside, they have maybe 1 or 2 applicants. So there's really, I think, a supply and demand issue we might be able to meet here.
So, like hospital at home, that will also save a lot of cost to the system as well, right?
Yeah, I think hospital in the home, hospital at home, or care anywhere, whatever you want to call it, is really going to save tremendously because by, essentially moving those patients into the home, you've eliminated a lot of the potential costs that you have. Obviously there's things that will be incurred, it'll be a little bit different. Like you might have to change your supply chain a little bit. Maybe that'll help our supply chain be more efficient because you're going to have to manage getting equipment into the patient's home. But actually home care organizations have done that for a long time.
So let me ask you, where do you see 5 to 7 years digital health going? I
think in 5 to 7 years, we're going to see the baby boomers have aged out, right? So they're all kind of hitting that sweet spot.
And providers, it's not the stakeholder only patient. Providers are getting old also.
Correct. And we have the digital natives that are coming on, and the digital natives are, I think, going to drive it, right? So it'll be supply and demand. They're going to want digital health. They're going to want more options and more opportunities. To do, if they do a face-to-face, it'll probably be most likely virtual because that's what they're used to. I totally see the opportunity for the metaverse to impact here. Yeah. I don't know how. I know that's like a buzzword. Everybody says it. I don't know how that'll impact, but I definitely think that we'll see the metaverse. We talk about that at Microsoft all the time.
We talk about VR in healthcare also.
So, I mean, potentially, I could be sitting here, my doctor could be sitting there, but it would be the metaverse, right, within
Yeah.
the metaverse, and be able to do that. And I'm hoping that it'll kind of alleviate some of the pain that we're feeling right now within our workforce.
No, hybrid care. I think when the COVID hit, I feel like it was challenge for both patient and provider because provider wasn't ready for big change from going virtual. As same with the patient, especially elder patient.
Yeah, it was tough. It was definitely tough for both. I think patients actually, in some ways, may have adopted a little bit easier than providers. I was talking to providers that were trying to figure out their schedule, right? How do you fit in a virtual visit with in-person? And then they actually figured it out, right? Maybe they do all their in-person visits in the morning and their virtuals in the afternoon. How do they complete their documentation with those virtual visits? It was nothing they had done previously, so they kind of had to learn. I had providers that actually were in their homes doing virtual visits, and they did kind of like that opportunity rather than being in their office. I think for the patients, we need to remember that when we put devices in homes, we have to explain very clearly what they do to the patient. We need to take into consideration, if they're elderly, if they have any issues, say with like dementia or memory or Alzheimer's, things like that, how can we help them and how can we help the families? Because by moving patients into the home, we're offloading a lot of their care to their care providers or their families or whoever is caring for them. And if they don't have that support system, it can be very difficult. So we need to take that into consideration.
Okay, I think before Tori calls us, we should go.
I'm good with that.
Okay.
Does anybody have any questions? Oh, wow, okay. Go for it.
So you talked a lot about technology. I'm wondering about the training side. How are providers being trained to do proper assessments virtually?
Yeah, that's a really good point. And I don't necessarily know that they really are, right? Because we still have in nursing, and I'm not a physician, but we have physicians in the room where they still do the classic, right, residency and internship, like obviously for nursing. And that is a big problem that we see. Interprofessional education, how is that completed and how can we change it? And I spoke at the Biden Institute back in May, and there were a lot of universities there, and they're very concerned about that. So there's plenty of people trying to get into medical school and nursing school. We don't have enough spots because we don't have enough educators. Remember, I talked about nurse educators are older. So is a 56-year-old educator really going to tell the 20-year-old how they're going to do virtual care? Probably they don't know enough about it to do that. So that's a really good point.
So following up, are American Nurses Association or AMA thinking about adding certifications guidelines?
They are. They're actually the American Hospital Association as well, the AHA, because they just wrote their guidelines out for workforce, and a big part of it is how we're going to train the workforce because it's changed so much. So it's a really good point.
I think both compliance side and education system side, there has to be lots of changes to adopt virtual care and telehealth. It has to be added both in education and the compliance guidelines.
Correct. And there was another question?
Can you ask me?
Yeah, go for it.
Yeah, I'm hearing a lot about data, the cloud, all that. I don't hear a lot about engagement of the patient, and I want to know about that. That's what our company's driven on, is patient engagement with mobile clinics for women and rural areas. We've got 35 million people in this country that are 2 hours more from the closest doctor. So we're not talking about at home. We all know that at-home care is the fastest growing part of healthcare in America. But we're going to be putting telehealth hubs in volunteer fire stations and public buildings like public libraries that we're putting into those places because they have broadband, and most of rural America still does not have broadband.
So
Correct.
And the other part is, I've been involved with telemedicine, telehealth since 1998. Okay, 1998. When there was, I was the project manager for the U.S. Army's program. Our pilot was a Navajo Indian reservation in Arizona. It was a total failure. Total. There was no broadband. There was no such thing as cell towers out there. Smartphones. And so the thing is that, but now with what we've got out there, the ability to get into
Yeah, I agree 100% with everything that you've said. Microsoft actually has a very large airband initiative, which is to get broadband out to especially rural areas. But I will also say urban areas, right? The inner city poor, they cannot afford broadband as well, and they also need telehealth. So it is definitely across the board. So we do have a very large airband initiative that we started, I want to say about 4 or 5 years ago, which is to get broadband out to these rural areas so that they can participate in things like telehealth. I think originally it was really for the farming community to help them within, obviously crops and things like that, but definitely it's top of mind around telehealth because of that. And also assisting and helping the federally qualified health centers, right? So we need to help them because that's where they are. They are mostly in those, in critical access hospitals, they're mostly in those rural communities. So I agree with you 100% that we do need to be conscious of that. And I think that's going to come down to what... So it's very difficult to engage those patients if they can't get connectivity, right? So that's why we have to work really hard to get them connectivity so that they can engage. But I think you're 100% right. I think that to Alpesh's, what he had said, it's really going to be around compliance and regulatory, right? How do we, as a government, right, U.S., how do we as a country decide that we're going to care for everyone regardless of where they reside?
And I would also say, like, we have to make, I don't call a patient, but consumer, take more action. More than patient, a consumer, take more action. So patient is somebody who's already identified with the condition, but we have to go one step ahead in preventive stage where we take them as a consumer, make them take action, like put their diet, food information is their wearable data in, bring their health records in through HI's network or EMR integration, create a data bank for the patient. Currently, a patient don't have, means I always compare health with wealth because everybody cares about their wealth more than their health. Everybody knows where their money is, but nobody knows where their data, healthcare and health and wellness data is. As a consumer, you should know where are all the health records are. Where is my lifestyle data? Or elderly patient, it can be remote patient monitoring data. And where is my diet data? So if I go to provider, I can give them every information they need before they ask. Instead of them asking, what did you eat last week? How much steps you walked? How much sleep you had? I can present them the whole data set and they will be able to make better decision on my health and give me a preventive guidance rather than focus on treating disease or condition. Make sense? So it's going back to Chase app, right? In 2007, I downloaded Chase app. It will do nothing but find me a location nearby my house. But now I can do everything through Chase app as manage all my wealth. I can deposit my check. I can send money to my friends, everything. Same thing has to happen with healthcare, where patient has to have their complete healthcare in their hand. Yes. I know we are over.
Oh, we're good for time?
Okay.
Thank you, everybody. One
Okay.
minute. Any other questions?
So,
I don't know if we answered you, but I totally agree. It's a problem.
so rural area, it has to start with the internet and broadband, but patient engagement has to start with how it will help patient, right? Why patient will take that initiative to put their diet data in or connect their wearable devices in. It has to help with them somewhere, Means one of the initiatives we are doing at Ravkoo is we are generating a health score similar to credit score for a patient. So we instead of telling patient what is, just like a wealth, you tell what is your credit score, and that defines how well you're doing financially. Same thing, you should have a health score that can define how well you are doing with your health.
Thank you, everybody. Appreciate it.
Thank you.